When a traumatizing event occurs, the mind suppresses the memory that will be formed, moving it into an unconscious section of the brain. Recovery of those memories may or may not occur throughout someone's life. The validity of recovered memories is a highly contested debate between psychologists, therapists, and social cognitive scientists. Today we will present both sides of the debate and present our own thoughts on the validity of recovered memories.
Loftus, in her article, The Reality of Repressed Memories, presents the topic of repressed memories and states that numerous clinical examples of repressed memories exist. Psychological disorders such as depression, anxiety, eating disorders, and sexual dysfunction can be related to a childhood trauma that may have been repressed. Until therapy, the memory of that trauma may be locked in the subconscious, and only when discovered can victims begin to heal psychologically.
Pope suggests the idea of false memory syndrome, and most particularly, the False Memory Syndrome Foundation, which was a foundation created by the leading psychologists, therapists, and social and cognitive scientists to debunk the myth of false memories. Kenneth Pope in his article states that memories are not recovered, but these memories are false memories suggested to clients by therapists. Now, the reason that the clients may be suggested these memories can come from reasons as diverse as well-meaning naivete, greed, or simple incompetence on the part of the therapist. Clients may uncritically accept these suggestions as facts and strongly believe in them. Pope suggests that false memory syndrome also may just be an extension of personality disorder. The reason that he makes this case is largely because of the demographic of those making accusations of repressed memories. The major demographic is women in their middle age who already have a previous history of personality disorder and who have been deemed unusually suggestible to ideas.
Considering both sides of the argument, professional consensus on child abuse and repressed memories fall into four categories: pernicious nature of child abuse, internal mechanisms of human memory, proper diagnostic and treatment techniques, and proper professional role of psychotherapists. According to Knapp and Vanderkreek, children who have been abused are 4 times as likely to develop psychopathology than non-abused children. But that does not limit the unabused children from developing disorders from other sources. Therefore, some cases could be true for repressed memories, being the case of a disorder or the effect of
Females and 1 in 10 males are victims of childhood abuse. It is an uncomfortable subject to discuss and largely goes unacknowledged because of the repression of the memories of this trauma. The memories may not be entirely repressed. Glimpses or brief flashbacks may occur during normal activity that could have sparked a path to rediscover forgotten trauma. In the case against George Franklin in 1990, the accusations of murder came from his daughter Aileen. She stated that when playing with her own child, she had a flashback of the murder of her best friend. Cases exist in which a recovered memory can aid in the prosecution for a crime. The case is strong because corroborating evidence was found to suggest that Aileen's recovered memories were true memories. Loftus presents a case of a 27-year-old borderline man who had discovered memories of his mother attempted suicide when he was 3. This memory was corroborated by the father, who confirmed that the mother did in fact attempt suicide at the time. Cases such as these lend validity to the recovery of repressed memories.
Elizabeth Loftus and Catherine Ketchum have co-authored an article entitled The Myth of Repressed Memories. In this, they discuss the dynamic of both one-on-one sessions and group sessions of therapy. These started becoming extremely intrusive. Therapists and group members would exert pressure on other members, encouraging them to remember. In fact, they would force them to remember. This would cause a mental strain in most clients. People would try too hard to remember, and this would cause them to crack. One woman said that she felt like she was developing a psychosis during the treatment. Now, these psychoses can lead to any number of problems, such as depression, destroying the marriages of the women in therapy, and even attempted suicide. 4 out of the 5 women in the study began taking medicine for antidepressant at this time as well. Flashbacks would occur at random time during the day, and distorted and strange images began to embed themselves in people's memories, coming from nothing that they had ever remembered, but were created from the sessions. One client said that she was rapidly losing the ability to differentiate between imagination and her own memory.
That being said, while it has been proven possible to implant or suggest memories to someone who is easily suggestible, the validity of all recovered memories must be taken into account. The False Memory Syndrome Foundation created a criteria for a person to determine the authenticity of their memories. The first of the 3 tiers of criteria begins with whether the person can find corroborating evidence. The client may say that the memories do not feel like other memories. Finally, the client will find a great sense of a relief if they retract a false memory statement. The second tier deals with accusations. The criteria says that a memory is usually false if there is no evidence of memory until therapy. On another note, the physical and emotional appearance of the accused or the accuser. The third is the willingness to discuss the situation. The side that refuses to discuss is the side most likely in the wrong. The third criteria is a lie detector test. This is the clearest way to detect a straightforward, purposeful lie about a memory, but may not be enough to create a case against someone who genuinely believes that they are remembering.
Diagnosing child abuse is a difficulty because there is no present description of what actually happened to someone, where they remember it, and what kind of psychological symptoms will be the result of them. Therapists help with remembering the childhood abuse because of the combinations of symptoms that may be present in a victim who can't think of a reason for having the particular combination of psychosis. Academic books have been written to help therapists diagnose victims of child abuse who have repressed the memories of the trauma. The research has been done. The therapist is the person who can lead the victim on the path of rediscovery.
The problem of bias also comes into play. Attorneys, be they defending or prosecuting in the trials that go to court, are going to be biased towards the side that they are on because they are going to want to win. There is a bias in the memory as well. When recounting a story, oftentimes one does not accurately describe what happened. We dramatize the story with what we wish we had said or what we had been thinking at the time, and we do this so that we sound funny or witty or intelligent or braver than we actually were. We dramatize the events to the point that we start to lose the truth of what happened, and we can begin to believe ourselves these things that are not true. Bias occurs in the therapy office as well, because therapists may genuinely believe that a victim is a victim of abuse. But if a therapist makes that diagnostic, they could be doing it to help the victim reclaim their past, or they could be doing it to a client that has no memory, but they may coerce the client into believing something that's not true. This may be for the fact that they believe that they're actually helping the client based on previous examples of child abuse and the psychosis resulting. However, there are more malicious reasons that a therapist may do this as well. One of the reasons being that if they make the accusation and there's no memory, the therapist may want to back up their claims or at least convince the client that the memory is true simply because this will lend credibility to the therapist's own practice. And the most malicious of all is when a therapist coerces the client into believing something that's not true simply because the more problems that a person has, the more sessions that are going to be required to fix it, and the more money that is going to be in the therapist's bank.
There are many issues that make the topic of repressed and recovered memories difficult. Personal motivations, pre-existing psychological disorders, bias, and the malleability of memory.
Documentation to suggest that recovered memories could be true or not true. From all the evidence presented, it can determine the absolute repression is not real, but being able to lose a memory and recover a memory is real.
Discovering the cases of trauma that are in fact not real will help lend validation and respect to the cases that are and to the victims who have survived them.